What impacts women impacts everyone. We're the workforce, we're the caregivers, we're the providers, and changing the trajectory and creating solutions is probably the hardest part of this. We can't do it without women in the state.
People should care about maternal and child health because the health of a society is really measured by the health of its women and children, some of the most vulnerable people in the community.
You can't have one without the other. Moms and babies go together.
Women are giving birth to Mississippi children. And if we don't take care of women who are in need of health care, it has the potential to negatively affect and impact entire families and households. It's everyone's issue.
When we think of a maternal health desert, that means that particular community does not have access to maternity services.
And if they do have access, it's often over several miles before they can actually get to an OB. Not only that, Mississippi also has a high number of counties that are health professional shortage areas. And so that means that even for basic care, like a family practitioner, general practitioner, a specialist, dentist, mental health providers, they're short. Why would a hospital close in a primarily Black county? What should have been done to make sure that that hospital could stay there, especially since it's the only one providing care? Those are the kind of things that we have to do systematically. It's not going to happen overnight, but it definitely won't happen if we're not going to acknowledge that the health disparities and the health inequity exist in the first place.
We often think of a maternal death as mom died right after giving birth. I think 86% were postpartum, but 37% were beyond that 6-week cutoff period. And so from that report, no, we don't know how many had health insurance, but when we review those cases, you can pretty much tell the impact that all of the decisions in our state had on those lives.
Obstetricians have pointed out that most of the life-threatening cases that they see happen in that period between 60 days and a year. It's a life and death issue.
I'm here on behalf of Mississippi moms. Postpartum is longer than 60 days, longer than 90 days, longer than 6 weeks. It's longer than 6 months.
They discussed the issues also on healthcare.
Exactly. It took me a year to recover from my cesarean after my daughter, but this time around, it's not taking as long because the care and the things that I've learned.
Mothers in Mississippi now have access to medical care for a full 12 months following pregnancy. This coverage includes doctor services, hospital services, family planning services, screening and diagnostic services, nutritional counseling, health education, mental health care services, and home visits.
With the Medicaid, I hope that it helps, and I hope that they help in the best way. Explain to us, what would this help us with? You know, don't just give me a piece of paper and say, hey, you got insurance for the next year and be happy. Explain to us, break it down to us, what is allowed and what isn't. What can we say no to and what can we say yes to with these physicians?
This postpartum Medicaid extension will hopefully open the door for Medicaid expansion as well as presumptive eligibility for pregnant women. That's the next thing on the horizon, making sure that women are presumed eligible for Medicaid and start receiving prenatal care as soon as possible. With Medicaid expansion, we get a 4-to-1 match, meaning Mississippi, for every dollar they put into the Medicaid program, they get $4 back.
When we talk about things like Medicaid expansion, it's important because it gives these women at least access to preventive care services, and it also gives them other support services that they can use to help make sure that they are healthy before they have a baby as well as during.
People who fall in the gap, they're $30,000 with 3 children, you make too much money. You know, when you're thinking about that, that's not a lot of money for a family, but it's also about they no longer fall into Medicaid eligibility. So what happens to them? They may not be even eligible for the Affordable Care Insurance. So they fall into this gap. But if we expanded Medicaid, we would have more of those people being able to be covered.
The voices are here. The voices are doing. The voices are being and living this daily, but the voices aren't heard. So the question should probably be, who needs to listen? There's no shortage of women. There's no shortage of Black women in this fight. Nothing pains me more than to hear some of our state leadership say, I don't even see the numbers, I don't see the data. Like, the data is there.
It's scary. We've got to do something to protect women, to protect children, to protect families by making sure the hospital infrastructure in the state of Mississippi is solid, it's welcoming for everyone. You know, COVID-19 and the pandemic only magnified issues that were already existing before the pandemic. It was already there. The lack of health care, health disparities, racial inequities were only magnified. Now is the time to make sure that we can remedy all of this and help strengthen families in Mississippi from a healthcare perspective.